Hello, ladies and gentlemen. Welcome to the HearSay podcast. I'm your host, Maxwell Ivey, and I am a Caucasian male with medium-length brown curly hair, brown eyes, wearing a red button-down shirt with a black tie, sitting in an office chair in my bedroom, which is also my recording space. And today on HearSay Shorts, I'm joined by Rosemary McDonnell. She is the Senior Disability Access and Functional Needs Program Manager at the D.C. Homeland Security and Emergency Management Agency. Rosemary, thank you so much for joining us on HearSay Shorts.
Max, thank you so much for having me. So as Max mentioned, my name is Rosemary McDonnell, and my pronouns are she, her. I'm a Caucasian female in my mid-30s, and I'm wearing a black blazer with a neutral colored shirt underneath. I am sitting in a conference room, and I have a long, dark brown curly hair.
Well, thank you. We're very happy to have you on the show. So why don't we start by you sharing some of your professional background and perhaps one of your accomplishments that you're most proud of?
Sure, thanks for asking. So my current work at the DC Homeland Security and Emergency Management Agency focuses on integrating the needs of all populations, including those with disabilities and other access and functional needs, into our emergency planning for the District of Columbia. And my previous roles mostly focused around public health and healthcare crisis management in hospitals and health systems throughout New York. I led efforts to combat the COVID-19 pandemic by making sure that we were accounting for all of the populations that really needed the most intervention when it came to that in terms of health equity. So after the COVID-19 pandemic, that's when I really found my passion for this work in accessible emergency planning. And I focused my efforts on forming a subcommittee of our emergency management committee, focused on reducing the healthcare disparities for the disability community and really making sure that we were integrating accessibility and inclusion into our health system's emergency planning efforts. Through my work in healthcare, I also manage many public health grants and strategies related to community health and resiliency. And I found that most of those grants were really lacking in the area of having health systems and hospitals and other healthcare facilities look at what it means to be accessible, especially in terms of emergency planning. And this passion for inclusive emergency management rolled over into my academic work, and I earned my doctorate of professional studies in Homeland Security from St. John's University, where my dissertation really shed light on the lack of sufficient emergency planning efforts in hospitals in New York City. For this study, it was deaf, blind, and hard of hearing, limited English proficiency, and blind and low vision populations. So I'm pretty proud of how I melded the academic and practitioner work that I was doing to feed into each other to further this work. I think there's a big gap when it comes to that. We need the research to back up the policies and procedures that we want to put into place in statewide, nationwide, and inclusive emergency planning. And then I also incorporate these concepts of accessibility into the courses that I teach as an adjunct professor, both at St. John's University and Idaho State University. I'm especially proud of forming one of the first courses of its kind in Homeland Security curriculum titled Accessibility and Inclusion in Disasters at Idaho State University, and really looking forward to teaching that in the spring 2025 semester. But when I think really about what I'm the most proud of, it's being a disruptor and bringing accessibility to the table, especially in healthcare, where I think it needs it the most, by forming that subcommittee, by just standing up and saying that this needs to be talked about. And with the research, like looking into the background and the reasons behind why these populations have been disproportionately impacted, and the behaviors of humanity in general, and how we can really influence that with policy and planning and get the community to do what is going to keep them safe.
Right. Now, I think you touched on this just a little bit, but I'm wondering if you could share a little more about what inspired you to get involved in the accessibility industry or arena?
Yeah, of course. So it actually goes back to my undergraduate days at St. John's University. I had planned a trip to Washington, D.C., of all places, where I eventually wound up to visit. One of the visits on the trip was to FEMA's headquarters, the Federal Emergency Management Agency. And we got a presentation that I wasn't expecting from their Office of Disability Integration and Coordination. And they had talked to us as students about a program where they go into the homes of blind and low vision individuals, community members, and they actually show them how they would physically evacuate from their households if they had to. And this was the first moment where I just had this sense of mindfulness that I didn't have before, of walking into a space and thinking, what would be different or difficult for someone without the same abilities that I have, whether they be physical, cognitive, whatever it might be, and just witnessing those disparities that occur for populations that have disabilities in emergency situations. And that was really materialized as I worked through the COVID-19 pandemic at a New York City hospital. And I witnessed how the services and the things that we were doing to serve the community were not really serving those that needed it the most. And that encouraged me to perform my research and look into this further and discover, why aren't we considering these populations? Why are we accepting that a majority of the people who are suffering before, during, and after emergencies are those with disabilities and other access and functional needs? And we're really seeing those same disparities right now in Hurricane Helene. There was just a vertical ascending evacuation of more than 50 patients and staff that were stuck on a roof of a Tennessee hospital that needed to be evacuated in the face of these rising floodwaters from the storm. And thinking about an ascending evacuation, also a descending evacuation, someone with a physical disability would not be able to evacuate that way without some type of evacuation device. So my inspiration for my current role was actually as a result of a settlement agreement by a disability advocacy group against the District of Columbia. This same disability advocacy group or plaintiff had sued cities such as Los Angeles and New York City before they sued the District of Columbia. But my role was really focused on, when I took this job, working through that settlement agreement. And it taught me a lot about the perspective of people with disabilities in a disaster, and where we may have been lacking in the areas of outreach and integration, communications, mass care, transportation, all these different mission areas that, for the most part, maybe we were doing some work to include people with disabilities, but we weren't doing it consistently and maybe reporting it in the way that we should have, to help with longevity and make sure that our planning efforts were going to be the same for years to come.
That makes perfect sense. So, as somebody who has all this experience dealing with various government agencies, what is your opinion on the current conditions of local, state, and federal governments when it comes to digital accessibility?
So I think that, along with other areas of accessibility, not just digital accessibility, for the most part, we are used to checking a box. And that goes beyond even emergency planning. I think in most industries, we don't have the time or the staff or the resources to really address these issues of whether it be digital accessibility, emergency planning, and beyond, holistically and in a meaningful way. And that's not the fault of anyone. I think that there's also a lack of guidance out there, and a lack of guidance that is digestible to someone who has no knowledge about accessibility, or in this case, digital accessibility. So while there are guidance documents out there for 508 compliance and the like, it sometimes goes over the heads of people that have never seen this information before. So in terms of the current state, I would look at the whole picture. I'm not just looking at digital accessibility when it comes to web pages or documents. I'm looking at meetings, making inclusive meeting spaces, whether they be online or in person or hybrid. How are we performing alerting? So that doesn't always mean the mass notification system that's sending out texts and emails and voicemails. That's also looking at the in-person notifications that we're making that are sometimes more meaningful. But when I think about in terms of the District of Columbia government space, we really look at accessibility through not just through the lens of people with disabilities, but we're planning with people with disabilities, not just for them. And I think this is something that's really missing from the government space at large, local, state, federal, is working in tandem with the disability community. Because while I have done research about this and I can read about accessibility all day long, I do not have lived experience with every single type of disability that you could imagine. In summation, I think when I think about digital accessibility and the current state of it, it's not really engaging those who need to be engaged, and it's not including everyone at the table. And I think if we did a lot more of that, then we would be in much better shape.
Right. So then, if I understand you correctly, the most common issue you would have with digital accessibility is that governments are seeing it as a standalone item as opposed to part of an overall systematic approach where they connect with and collaborate with their disability communities.
Absolutely. When I say digital accessibility, all anyone thinks is 508 compliance. It's nothing beyond that. So I think once we can get to that state where we're thinking of the different modalities and different ways we can engage and have touch points with the community, then that's when we're really going to get somewhere.
I'm curious as to how you have pushed for accessibility to be prioritized by governments, especially considering how tight their budgets can be.
Yes, budgets can be tight, but I think that there are a lot of things that are free of cost that are sometimes the most important elements of accessible emergency planning. And what I think of when I try to brainstorm about how to address an issue or push an initiative forward is that I cannot do it alone. I need to build a support network of either like-minded people that also care about this work in inclusive emergency management, or folks that are not necessarily related to emergency management, but have such a role to play in it. So the way that I've built a support network in my current role in district government is that I've created a network of district government agencies and representatives from each that serve on somewhat of a committee that holds workshops and addresses topics in inclusive emergency management. Most of them align with the mission areas defined in that settlement agreement I had mentioned before, but we've evolved since then. So some of the topics could be communication, which also now includes outreach and engagement. It could be on mass care and sheltering. It could be on transportation. But getting those folks together in a room is free. And most of the most beneficial conversations happen in those rooms. So that is where we really do the planning. Also, when you're thinking of that support network, of course, you want to include the community. I talked a little bit about the focus groups that we've held with people from the disability community, the Disability Community Advisory Group, just creating a forum and a space for people to, one, speak their mind about what it means to be inclusive in your disaster planning, but two, to learn and educate folks on what's currently being done, what are the best practices out there, and training and getting people comfortable with the topic. If you look at, fun fact, if you look at remotely located tribal communities, there's been studies on these, they have very high rates of survivability after disasters because they have that strength and their bonds amongst the community. So even during Hurricane Helene we're seeing right now, I actually had a close friend who lives in Charlotte, North Carolina, And what she had posted the other day with her limited service was that her number one lesson is to know your neighbors, get close to your neighbors. So it just further proves that in times of disaster, you need that connection, and that making that connection and those bonds are free.
Right. Now, my last question is since the Department of Justice announced the updates to Title II, we have been getting a lot of requests for information from governments across the country. They want to know, where do we start? And I'd like to know, what would you tell them?
I would probably tell them, in line with my answer to your last question, to simplify your information for the population at hand that is going to be creating digital materials. So there is, as I mentioned, so much information out there about 508 compliancy, and it's important to put it into plain language for your audience and simplify it to get the main points across. Of course, you can have more advanced guidance documents for them and trainings, and that's great. But if you can't get those basic concepts, like putting alt text on images, putting captions on videos, and the tools that you can use to make sure that screen readers can read through a web page or a document, then you're not going to get anywhere. And a lot of the times people are apprehensive to approach this topic of accessibility because they don't have that knowledge base to go off of. So they don't want to say the wrong thing or do the wrong thing. So they just avoid it completely. So beyond the guidance and the education, which I'm very supportive of, and I think it's really, education is the crux of accessibility, compliance, and digital accessibility, I would say identify your gaps by engaging with the communities that are going to be testing out these materials and consuming these materials. So making sure that you're getting that immediate feedback.
Right. I want to thank you for coming on our show. I have really enjoyed talking with you, Rosemary, and I look forward to seeing even more progress being made in the area of accessibility as it applies to emergency management, because as you've said, with our climate changing, we are going to see more of these events.
Absolutely. Thank you so much for having me.
You're very welcome. HearSay Shorts is produced by Sojin Rank, Mike Barton, Mariella Paulino, Missy Jensen, and Max Ivey, and is edited by Alex Dorrier. If you enjoyed the podcast and don't want to miss any future episodes, please subscribe to our YouTube channel. Thanks for joining us. We'll see you next time.